More than half of California nursing homes balk at stricter staffing rules. A Georgetown study shows that low unemployment correlates to poor nursing home quality, and a nursing home that repeatedly hung up on a deaf woman is ordered to pay up and train staff. This and more next.
You're watching LTC News with Dane Henning.
Welcome to CNA-TV Long-Term Care News. I'm Dane Henning. Today is Wednesday, December 12th, 2018. More than half of California's nursing homes are asking to be exempted from new state regulations that would require them to spend more time directly caring for their patients. The state's new staffing requirements for nursing homes quietly passed in last year's budget bill seem universally unpopular. Patient advocates say the new regulations don't go far enough and that residents remain at risk in poorly staffed homes. Nursing home operators say they can't hire enough staff to comply. Under the new rules, which took effect in July but haven't yet been enforced, skilled nursing facilities must provide at least 3.5 hours of direct care per resident per day, up from 3.2 hours of care previously. The California Department of Public Health is expected to announce in late January which, if any, facilities it will exempt from the new regulations. Researchers have strongly linked more nursing staff with better care, with some experts recommending from 3.8 to 4.1 hours of care per patient per day as a bare minimum for quality nursing home care. A booming economy may be detrimental to nursing home residents, according to a new study that was released on Friday. Georgetown University Medical Center researchers came to that conclusion by scouring data from 2001 to 2015. They found that higher unemployment rates are associated with notable improvements in the quality of nursing home care, but when that rate drops, so does care quality, with residents more likely to suffer pressure ulcers, be physically restrained, or have significant weight loss, according to the study published last week in the Gerontologist. The reason being that when the economy is good, other business sectors have the ability to raise prices and pass higher costs to consumers, while nursing homes have little flexibility to raise wages and benefits to attract nursing staff to work for them, creating poorer staffing ratios and worse quality. The unemployment rate in the U.S. fell to a 49-year low in September and October, with experts suggesting providers pay closer attention to health deficiencies and invest in approaches to lower their turnover. We'll be back right after this break.
Join us as we honor CNAs with your host, Lisa Sweet. CNA Heroes, Friday at 7 p.m. Central, only on CNA-TV.
A New Jersey nursing home could be on the hook for more than $12,000 in penalties after one of its workers repeatedly hung up on a deaf social worker. Nicole Perkins worked at a local hospital system and was trying to contact Atrium Post-Acute Care of Wayne, New Jersey on behalf of a client who also had hearing loss. An Atrium employee repeatedly hung up on her on that day in May 2016, the Attorney General said last week. To resolve the allegations, Atrium must pay Perkins $2,500 along with being subject to a $10,000 suspended state penalty. The latter fine would be reinstated if the nursing home defaults on any terms of the settlement or commits a new violation over the next 2 years. Atrium also must train employees on services and devices used by the deaf and hard of hearing. Perkins had used a service called Purple Communications, which involves an operator relaying the call via text or FaceTime to the intended recipient, letting them know a deaf individual is trying to connect. The Atrium employee repeatedly refused the operator's attempts and later told investigators that he thought it was a robocall. Atrium employees in interviews with the Division of Civil Rights admitted they were unfamiliar with such relay-assisted calls. This has been your long-term care news update. Everyone have a wonderful week, and I'll see you on Wednesday.